The power went out on a Tuesday. You didn't think much of it at first. The hospital had backup generators. It had always had backup generators. You finished the appendectomy you were halfway through, closed the incision, and told the nurse to check the board for your next case. The board was dark. Every screen in the hospital was dark. You walked to the window. The city stretched out below you, 17 floors down. Every traffic light, every street lamp, every lit window in every building you could see, gone. Just black. Miles of it in every direction. Your phone had no signal. That was 3 weeks ago. You are now the last functioning surgeon in a city of 2 million people. You didn't choose this. You didn't volunteer. You just happened to be here, in this building, with these hands, when everything fell apart. The other surgeons left in the first week. Dr. Harmon took his family north on day 2. Dr. Reyes followed on day 4. By day 7, you were the only attending left in the building. You told yourself you'd leave too. You're still here. The hospital is running on its 3rd generator now. The first 2 burned out. This one has fuel for maybe 9 more days. And then the OR goes dark and everything changes. But right now, the lights are on. And right now, there's someone on your table. His name is Marco. He's 14 years old. He came in 40 minutes ago, carried by his older brother, unconscious, abdomen rigid, rebound tenderness so bad that when the nurse pressed and released, he screamed even under sedation. Classic presentation. Ruptured appendix. In the old world, this was a 2-hour case. Routine. The kind of surgery residents did on their 2nd month. You've done it 300 times. In the old world, you had a full scrub team, an anesthesiologist, a circulating nurse, a perfusionist on standby, and a crash cart with everything you needed if something went wrong. Right now you have one nurse, a flashlight duct taped to a stand, and a supply cabinet that's running low on everything that matters. You begin. The anesthesia is rationed now. You use just enough. Not because you want the patient to feel anything. You don't. But because what you have left has to last. There are 47 people in the beds downstairs. Any one of them might need this tomorrow. Marco doesn't move. You work fast. 15 minutes in, you find the perforation. It's bad. The infection has already started spreading. In the old world, you'd have IV antibiotics running by now. A full course. The right dosage, precisely calculated. You have what's left of a stock that was meant for a hospital running at normal capacity. You use what you can, and you hope it's enough. You close. You wash the cavity. You close again. 1 hour and 12 minutes after you began, Marco is alive. You step back. Your gloves are wet. Your back is on fire from standing hunched over a table that's slightly too low, because the adjustable mechanism broke on day 9 and nobody has fixed it. You pull off your gloves. You drop them in the bin. You walk to the hallway and sit on the floor with your back against the wall, and you close your eyes for exactly 4 minutes. That's all you allow yourself. Because outside this building, word has spread. You didn't plan for that either. You didn't announce anything. But people talk, and what they said was simple. There's a surgeon at Central Hospital. He's still there. He's still working. That was enough. By the end of the first week, people were arriving from across the city. Not just with injuries, with everything. Infections that had been left too long, broken bones that had been badly set by someone who watched a video online, diabetics who ran out of insulin, dialysis patients who hadn't been treated in 10 days. You treated what you could. You told the others to wait. You apologized to the ones you couldn't help. You stopped apologizing by day 12. Not because you stopped caring, because there was no time. The courtyard outside the hospital entrance looks different now. There are tents. People dragged them from camping stores that had already been mostly stripped, but they found enough. Families are camped out there with sick relatives, waiting for their turn, waiting to see you, waiting for someone with the right hands to tell them it's going to be okay. You walk past them every morning on your way from the room where you sleep to the OR where you work. You stop making eye contact, not because you're cruel, because if you make eye contact, they grab your arm. They tell you about their mother, their child, their husband, and you already know their story. You already know you can't help all of them, and the ones you can't help don't need to see that on your face. There's a man who runs security now. His name is Gus. He was a maintenance worker at the hospital before. When the chaos started in week 1, people rushing the supply room, Someone pulling a knife in the pharmacy. Gus organized a group of men who stayed. He doesn't call them guards. He doesn't call them anything. But they stand at the door, and they decide who comes in. You didn't ask Gus to do this. You didn't stop him either. Because without Gus, you'd have been overwhelmed on day 4. The supply room would be empty. The generator fuel would be gone. And you'd be standing in a dark OR with someone's life in your hands and nothing to work with. So you let Gus do what Gus does. But there are decisions Gus makes that keep you awake at night. Last Thursday, a woman arrived at the door. 70, maybe 75. Pneumonia. Advanced. She needed oxygen and antibiotics and monitoring and time. All things you have in limited supply and all things you're rationing for cases where intervention actually changes the outcome. Gus turned her away. You found out 2 hours later. You went to the door. She was gone. You asked Gus where she went. He shrugged. Said she walked back toward the east side. You haven't asked Gus about a case since. But you think about her. You think about her when you're trying to sleep. You think about the specific math of it, the antibiotics she would have needed, the oxygen hours, the bed space, and you run the numbers and you know, logically, that what you have left is already spoken for by the 47 people currently in beds, and the ones who will come tomorrow, and the ones after that. You know the math. The math doesn't help at 3 in the morning. Your supply situation is getting critical. The surgical sutures are down to 3 boxes. You've started being careful with every stitch in a way you never had to be before. Not sloppy, never sloppy, but precise in a way that's almost paranoid. Every centimeter of suture is counted before you close. Ketamine is your main anesthetic now. You had a good stock and it's held up, but it won't last forever. You've started doing procedures under local where you can. Where you can't, where it's a real surgery, an open abdomen, a chest. You use what you have and you count what's left after. The antibiotics worry you most. You've been rotating through what's left. Amoxicillin, ciprofloxacin, what remains of the IV vancomycin. But wound infections are increasing. People are arriving later than they should because it takes longer to get to you now. The roads are blocked in places. Some people are carried for miles. By the time they arrive, what should have been a clean case isn't clean anymore. You're losing people you shouldn't be losing. You know it. Your nurse knows it. Neither of you says it out loud. Her name is Diane. She's been here since before the collapse. Pulled doubles on a staff that was already short. When everyone else left, she stayed. She didn't explain it. She just showed up the next morning and started working. Diane doesn't cry. You've never seen it once. She moves through the wards with a calm that you've started to depend on the way you depend on the generators. Quietly, completely. Terrified of what happens if it stops. Last Tuesday, you lost a 12-year-old. Trauma case. Internal bleeding from a fall. You got him to the table within 20 minutes of arrival. Good time. Fast work. But the damage was too deep and too extensive, and you didn't have what you needed to fix it, and you knew that going in, but you tried anyway. Because he was 12, and you weren't going to stand there and do nothing. You worked for 40 minutes. Then you stopped. You told Diane. She nodded. She went to find the family. You stood at the scrub sink and washed your hands for a long time. That night, you walked up to the roof. The city was dark in every direction except for fires. 3 of them spread out across different neighborhoods. Small ones. Controlled, probably. People burning things for warmth or cooking. You stood there and counted the fires and listened to the silence where traffic used to be. Somewhere to the east, a dog was barking. That was the only sound. You stayed up there for a long time. The next morning, there were 62 people in the courtyard. You went back to work. There's a group that came on day 19. 6 of them, armed, moving like they had organized beforehand. They weren't patients. They walked past Gus and his people without stopping, which told you something had already been arranged. Their leader was a woman, calm, mid-40s, wearing a jacket with no markings. She found you between cases in the hallway. She told you her group controlled 3 neighborhoods to the north. Food stores, fuel, a water filtration setup. She said they could supply the hospital. Sutures, antibiotics, generator fuel, whatever you needed, through trade routes they'd established. You asked her what she wanted. She said she wanted access, not general access, not open doors for her people. She meant something specific. She had a list, names, her people, their families, and a rotating group she'd designate each week. Priority care, guaranteed beds, jump the line. You stood there in that hallway with the generators humming and Diane moving past with a tray and 62 people in the courtyard and 3 boxes of sutures left in the supply room. You asked her how much fuel. She told you. You looked at the floor for a long time. You said yes. You've told yourself it's temporary, that the supplies she brings will let you help more people overall, that the math works out in favor of the courtyard, not against it, that one prioritized group is a small price for everything the hospital needs to keep running. The math probably works out. But last Wednesday, a man named Ray had been waiting 3 days for a hernia repair that had become incarcerated. Critical case. He should have been next. One of the woman's names was on the list. Ray waited another day. His repair was harder when you finally got to him. He's okay. He recovered. But you think about that extra day. You think about it the way you think about the woman with pneumonia. You run the numbers and the numbers say it's fine, and then you close your eyes and it's not fine. The fuel came the next morning. 6 canisters. Enough for 3 weeks. The generator is running. The lights are on. Marco, the 14-year-old from the ruptured appendix, is awake now. He's in a bed on the 2nd floor. His brother sits next to him. When you did your morning rounds, Marco looked up at you and said, "Thank you." You nodded. You checked his chart. You moved on. You didn't let yourself feel it. You can't afford to feel it, because when you walk out of that room and down that hallway, there are people in every bed, and more in the courtyard, and more coming tomorrow. And you have 1 nurse and 3 boxes of sutures and a generator that runs on fuel controlled by a woman with a list. You are the last surgeon in this city. You didn't choose it. You can't leave it. And every morning you scrub your hands and you walk into that OR and you begin, because the alternative is standing at that scrub sink and looking at your reflection in the dark metal of the cabinet above it and deciding to stop. And you haven't decided that yet.